Welcome back to the channel. Today we're diving into a topic a lot of pre-med and pre-health students ask me about. Should you go to podiatry school? We're going to break down who podiatry is great for, who it might not be right for, how the training works, what has changed in the profession, and what life actually looks like as a foot and ankle surgeon. If you're considering this path, even a little bit, this is the video you need to watch. Let's start with the basics. Podiatry school is 4 years of medical education focused entirely on the foot and ankle. Your first 2 years look very similar to MD and DO programs: anatomy, physiology, pathology, pharmacology, microbiology, radiology, and musculoskeletal courses. You're in the classroom and lab grinding through the same medical sciences everyone else studies. But here's the major difference: MD and DO programs study every organ system equally, while podiatry programs begin focusing on the lower extremity very early. That means in addition to the traditional medical sciences, you'll also take courses like lower extremity anatomy, biomechanics and gait analysis, podiatric medicine, foot and ankle radiology, sports injuries, dermatology of the foot and ankle, wound care, and surgical principles. So by the time you start clinical rotations in years 3 and 4, you're already deeply immersed in your specialty. One thing students don't always realize is how dramatically the field of podiatry has evolved. Decades ago, not every podiatrist was surgically trained. It was similar to dentistry, where you had 4 years of school and then optional surgical or specialty training afterward. That era is long gone. Today, every graduating podiatry student must complete a 3-year surgical residency. It is mandatory, and the expectations are high. Modern podiatrists are trained in trauma, reconstructive foot and ankle surgery, limb salvage, diabetic wound care, sports medicine, flat foot and cavus reconstruction, tendon transfers, fusions, arthroscopy depending on the state, and advanced hardware fixation. The training has become rigorous, standardized, and heavily surgical, and this shift has significantly increased the profession's respect and integration within hospital systems. Now let's talk about the big question: who is podiatry actually great for? Podiatry is an excellent choice if you already know you want to specialize in the foot and ankle. Students who thrive in podiatry tend to love orthopedics, biomechanics, sports medicine, and surgery. If you're someone who enjoys problem solving, hands-on procedures, and the idea of mastering one anatomical region extremely well, then this path might be perfect. It's also a great fit for students who want a very clear surgical pathway from the beginning. While MD and DO pathways involve years of competition to match into a surgical specialty, podiatry students know from day one that their trajectory ends with a surgical residency and focused practice. And for people who want a career with a mix of clinic, surgery, biomechanics, long-term patient relationships, trauma, and reconstruction, podiatry delivers all of that. But we also have to be honest: podiatry is not for everyone. If you're unsure about what specialty you want, this path may not be the best option. Unlike MD and DO programs, you don't have the flexibility to switch from podiatry into emergency medicine, cardiology, general surgery, pediatrics, or psychiatry. The specialization is committed from day one, and it stays that way. And because surgical residency is now mandatory, you must be comfortable with the idea of operating, dealing with trauma cases, managing complex wounds, and spending time in the OR. If you're not sure about surgery, this can be a tough path. If you're someone who wants variety across different organ systems, podiatry may feel too narrow. And because the field is still relatively young compared to other medical specialties, you may encounter regional variability in how podiatrists are perceived. Most places are extremely supportive, but some institutions are still catching up with how advanced modern podiatry training has become. Let's talk about the pros and cons so you can get a balanced picture. First, the pros. Podiatry offers high surgical volume in many residency programs. There is strong demand across the country due to diabetes, sports injuries, trauma, and chronic conditions. Many podiatrists enjoy excellent lifestyle control once established because the specialty blends clinic and surgery. You get long-term patient relationships, a defined niche, and opportunities in trauma, sports medicine, reconstruction, and limb salvage. You also have flexibility in your career. You can join a hospital, partner with orthopedic groups, or build your own private practice. Now the cons. You commit to a specialty earlier than MD and DO students. The field is still misunderstood by some physicians and patients, though this has improved a lot. There is still variability in residency quality, although the vast majority are strong and the profession continues to standardize surgical training. You cannot switch specialties later if you decide you want to become a cardiologist or dermatologist. And because the training is heavily surgical, it may not be ideal for someone who doesn't want to spend a lot of time operating. Finally, podiatry is still a relatively young field, so advocacy for scope and recognition continues to grow, and you need to be comfortable educating others about what you do. So what's the bottom line? Podiatry can be an incredible, fulfilling, and impactful career if you know early that you want to specialize in the foot and ankle. The training today is rigorous, surgical, and deeply focused. The profession has grown tremendously in scope and respect, and modern podiatrists are essential members of hospital and surgical teams. But it's not the right path for students who are undecided or want the option to switch specialties later. If you're considering podiatry, I highly recommend shadowing a podiatrist, spending time in a surgical clinic, talking to residents, and understanding what the day-to-day life actually looks like. And most importantly, be honest with yourself about the kind of doctor you want to be. If you have questions or want a deeper dive into residency, lifestyle, salary expectations, patient cases, or surgical realities, drop them in the comments. I'll be covering more about the profession in upcoming videos.